Well, I know a girlfriend of mine that loves walking, and she tries to get me to go all the time, and I'm one of the persons that might have an excuse, but like,
No, that's cool.
yeah, I would. If it's like 3 people to go together, you know, and one might say, no, let's all just go, let's get it over with, let's do it. And because she walks along, she said it really makes you feel better. You feel healthier and more energized every day.
Oh, I like to walk. Jog sometimes, but walking a lot.
I never seen you jog, Cookie.
No, I said I like to do this. I'm gonna stop, but I haven't started. I used to do it 2 years ago.
You ring my bell when you start jogging.
No, I've been thinking about it a lot.
I would walk right after work. Like, I would walk from my job home, if you would call that walk, and get a couple of people to walk with me from work, you know? That's how I would do it.
I think a walking club would be very successful just because there's no special skills. Everybody can walk. Everybody can put their 2-3 feet in front of them. Also, you were saying that it's not something where you need to find daycare. You can have the kids run in front of you, run behind you. Also, as far as financially, you don't need any money to walk anywhere.
What do these women from Roxbury, Dorchester, and Mattapan have in common? They are all part of a change they are leading in their communities. In the city of Boston, local and national researchers are collaborating with these women on a prevention program to bring new vitality to their lives. According to the nation's top scientists and medical authorities, the problem for many women in the Boston area is obesity, a problem that can lead to a major health risk in the years ahead. Dr. Shariki Kumanyika, an epidemiologist at Pennsylvania State University, has studied the attitudes and behavior of African American women regarding weight control.
You have to be able to link your weight to a health outcome in order to feel that losing weight is important to your health. If you see a lot of heavy people walking around in your community, some of them dancing, taking care of people, taking care of a lot of people, it's not obvious that being overweight kills you. The relationship between being overweight and developing diabetes, is just any susceptibility, is so strong that nobody argues about that. It's not that well known, interestingly enough, in the community that that's where it's coming from, but I think that's probably the biggest health risk. Partly associated with that, heart disease is another big risk, and heart disease is the major killer of women, and diabetes is a risk factor for heart disease. So take those two together, you add hypertension, which affects probably 50, 60, 70% of black women over age 50, and you've got a constellation of factors that, if they don't kill a woman early, will begin to interfere with quality of life.
The reasons why the prevalence of obesity are so high in the African American community are unclear. But like anybody else, the only 2 areas that people are able to control are dietary intake and activity. In order to prevent weight gain, it's clear that people have to either reduce the quantity of fat that they're eating, the quantity of calories that they're eating, or increase their activity levels.
Dr. Dietz is widely acknowledged as a national authority on pediatric obesity.
It's important to recognize that weight is not immediately associated with medical problems, that medical problems develop from being overweight over a long period of time, and once they've developed, they're very difficult to treat.
Based on research supported by the National Institutes of Health demonstrating a strong relationship between being overweight and developing health problems, it was clear that a prevention and educational campaign for the high-risk population of black women would be beneficial. Dr. Dietz and other scientists from the New England Medical Center, Tufts University, and the Harvard School of Public Health have formed a consortium to collaborate with community leaders. Their objective? To reach out to black women to improve their health.
It's all about building skills. I think that it's one thing to know that these things aren't good for you, but it's another thing to do it, and it's how do I do it, and that's the big thing.
Like me, I use a lot of butter, and I know I shouldn't, but it's a habit, and it's like I gotta taste it. And I'm getting older, but you know, it's not doing no good for me or my kids, because then they're gonna grow up thinking they gotta have lots of butter on everything I cook. So, you know, I cut down. I could say I did, but I still like it.
If you're going to think about healthy eating, you would think about, you know, your vegetables, your meat, your fruits, and all that good stuff. That's what I would think about.
And have smaller portions instead of like how you normally sit there and you just pile everything on your plate.
Get people active. To get them out there and talking about health and talking about eating well, talking about taking care of themselves and developing a fitness program that complements who they are.
With the help of health centers and community leaders, the outreach and prevention program known as the Sisters Together campaign will be launched this fall. Sisters Together, Move More, Eat Better is the theme of the campaign, to be based in local neighborhoods. Health centers and other groups that participate will benefit as well. Free materials on nutrition, walking, and walking routes, information about healthier foods, and ongoing training and support of local leaders in physical activity and nutrition are some of the advantages offered.
One thing that's good about walking in the community, that it's free. You don't have to worry about paying no expensive health club to go work out. Walking also is good for toning up your legs. It's good for the cardiovascular system. Walking is really good because anybody can do it. There's no excuse. If you have children, you can bring your children. If you have little babies, push the carriage.
It's one thing if we talk about Roxbury, Dorchester, and Mattapan, but those can be satellites of pilot sites where ideally that would be really good. And we get the people motivated, then we start to expand into Milton, into other communities, to let people know what we're doing, to get the excitement, to get everyone talking about wellness, to get everyone talking about changing their diet, to get everyone talking about walking.
The Sisters Together campaign is looking for community groups, schools, and businesses to participate in the Roxbury, Dorchester, and Mattapan neighborhoods. Individuals are also needed to serve as walking group leaders. Training will be offered to all interested participants. Local media will help get the message out.
Ladies, are you wanting to feel more healthy? Be more in shape? Well, we've got a new program. It's called Sisters Together, Move More, Eat Better. It's sponsored by the WIN Project, and it's available in your community. Keep your eye out for posters and flyers telling you more about Sisters Together, Move More, Eat Better.
For more information on the Sisters Together campaign, call 617-636-7724. Sisters Together, Move More, Eat Better.